Hi, my name is Wayne Smith. I'm a practicing anesthesiologist. I work in a level 1 trauma center in Tennessee and decided to start doing some videos about what I do. Anesthesia is one of the more misunderstood of medical specialties. Most people only know that we do surgery, and all they want to talk about is how much money we make. So there's a whole lot more to anesthesia than that. A whole lot more interesting things to talk about with anesthesia. So I'm going to address some questions that I have received, both recently and over the years, in a series of videos, starting with this one. The first question that comes to me is about being awake during anesthesia. Specifically, being awake and unable to tell the people taking care of me that I am awake. All right. Intraoperative awareness is the technical term we use, and it describes when a person is not completely unconscious during a surgery. It can happen. The current studies are estimating that between 1 and 2 in 1,000 cases of general anesthesia can experience some degree of intraoperative awareness. Now, let's talk specifics when we talk about intraoperative awareness. That does not mean awake like you are right now watching this video. That simply means that you have some consciousness and can sense something that is going on around you. Now, you're very unlikely to be able to say, I woke up during my gallbladder surgery and I saw anything. There's a reason. We tape your eyes closed because in anesthesia, you are so asleep that you can't even blink. And so to protect your eyes, we put little strips of tape across your eyelids. So nobody's opening up their eyes, looking around during a general anesthetic. Most commonly, if a person is aware, the only thing that they recall later is that they heard conversation, that they heard voices. We do not often hear about more than that. The amount of pain that you might experience if you actually have any intraoperative awareness is not likely to be much, if at all, because when we do anesthetics, there is narcotic in your system, and that reduces how much pain that you would feel if you were awake. So I am unaware, I should say, of any of my cases that have had any degree of intraoperative awareness during general anesthesia. In the modern operating room, we have something called a BIS monitor, bispectral index monitor. It literally is an EEG monitor, electroencephalogram monitor, where we put a strip of leads across the forehead. It has a lead, let's see, a pad here, pad here, pad here, and a pad over here. And the black box that's attached to, I use that term in the informal sense because the box, is not even a box in our system. It's integrated into our monitoring system. But the computer inside of it analyzes the brain waves of the patient and spits out a number. If that number is below 60, you are definitely asleep. You will not have awareness of what's going on around you. We use that on patients who are high risk for having intraoperative awareness. There are 2 types, actually, from what I'm reading, there are 3 types of surgery that are more likely to have intraoperative awareness of some degree. Those would be the open heart surgeries, or major chest surgeries, which would be open heart and aorta repairs. And there's only There are only a couple of times during those cases that the patient might have some awareness. Another type of surgery that you might have awareness in is during an emergency C-section. We do our best to make sure you are completely asleep, but an emergency C-section is by nature an emergency, and our priority is safety of mommy, safety of baby, comfort is after that. So we try to get mommy as asleep as we can get her, which, as far as I've seen, has always been asleep, and get the baby out. And when you're doing an emergency C-section under general anesthesia, you want the patient to be completely asleep, but not to have been asleep so long that the baby has received a significant dose of anesthesia through the placenta. So it's a race. We literally take the patient back, get prepped, get the skin clean, get drapes up, be giving oxygen during this time, and then when the surgeon has a knife in his or her hand ready to start the C-section, the patient goes all the way to sleep. It's an adrenaline rush for all involved. It goes well in almost all cases. So that's another type of surgery that might have intraoperative awareness. The other is a major trauma. In trauma, our goal is safety of the patient, survival of the patient, with the mental experience being a secondary, desired goal, but a secondary goal. So anesthesia reduces blood pressure. Anesthesia reduces cardiac output. And so in a patient who has lost a significant amount of blood, if we make you sleep enough to be completely unconscious, we may kill you. Obviously, we try not to do that, but because of those factors, sometimes we cannot give enough anesthesia to prevent awareness during the initial parts of a surgery for a major trauma: motorcycle accident, car accident, stabbing, shooting, fall from a great height. Things of those natures are cases that are more difficult to ensure that the patient is not involved by virtue of having any awareness. So those are the three types of surgeries that might have awareness. That would be cardiac, major cardiac, so open heart, open chest, crash C-sections, and major traumas. The rest of the cases, if you took those out, I would say that the chances of intraoperative awareness are much less. Now, this goes back to a social aspect, which is nobody tells the good stories. If your anesthesia went well, you don't call up all your friends and tell them. If your anesthesia went poorly, you do. So if your fear of anesthesia is associated with being aware during the surgery, remember that. It is only the horror stories that get retold. So, all right, so that's an answer to one of the questions that I've received. I'll finish this up, post it, see what you think. If you like it, let me know. If you want me to do something differently in the way I do this video, I'm open to feedback, and let's see where this goes. Take care.